Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon. I live in Buenos Aires, Argentina. I'm specialized in laser technology. I developed a new technique that removes sebaceous cyst with a small incision, laser incision, and I have hundreds of educative videos in Spanish and in English to show my technique. Many patients around the world come to my clinic to perform this kind of treatment. The idea of this presentation today is take care of your cyst, because the cyst have inside a lot of sebum, and this sebum can be infected, and when the infection comes on, produce a destruction, a necrosis of the tissue. These patients send me pictures from the countryside, and only seeing this I can see a small layer of skin and all the destruction of the tissue behind this. I call fluctuation. Fluctuation is when you touch and move. A sebaceous cyst generally is strong, solid, but this have fluctuation for the necrosis of the tissue. The only procedure, this patient went to many plastic surgeons and general surgeons. All of them propose a big resection with a big scar. The idea of this kind of treatment is produce a drain of this infection, clean up, then after the local anesthesia you can see a laser and the remove of the contents.
Anestesia local, vemos la fluctuación del paciente. Esto prácticamente es un drenaje, porque vamos a ver cómo drena acá.
And this is the content of this area. All this is the cyst was digested for the infection. I need to remove all this and clean up. Summarizing, if you have a cyst, remove it, because in one moment this sebaceous cyst can produce an infection. An infection can produce a necrosis, tissue necrosis, and this is a little difficult. Have a nice day.